All right. My name's Colin. I'm here with a friend of mine. Thanks for your time today. I do appreciate you joining me. And I was just wondering if you would like to introduce yourself.
My name is Damien. I am a CSU East Bay student in the PHAP program with my colleague here, Colin.
Excellent. And so you shared a recent medical experience that you had, and I was wondering if you could describe what led to the event, also how you felt before, during, and after the event.
Sure. So about 3 weeks ago, I woke up in the morning and I immediately knew that something was wrong. I have some medical background. So I checked my pulse. I found that it was irregularly irregular and that it was very fast. I measured my pulse to be between 160 and 170 beats per minute, which is almost like twice, and for some people, 3 times as fast as it should be. That's like very strenuous levels of exercise. And I was just laying there. So I walked around a little bit. I tried to get it to slow down using some medical techniques that I'm aware of, and nothing quite worked. I let it try to self resolve for about an hour, and it didn't. It was still really fast and really irregular. And I told my wife, and she said that if it were her, I would tell her to go to the emergency room. I was very hesitant and not looking forward to doing that, but she made a valid point that I would make her go, so I would listen to her and I would go since she was telling me. So we went off to the emergency room and I let them know what was going on. When they brought me in a triage, I used some vocabulary that probably may have sparked a few bells and sped the progress up along a little bit. But they measured my pulse to be 160 and irregular as well. So I was brought back fairly quickly to a room in the ER. And from there, a nurse came by, hooked me up to the monitor, gave me some medications, and started an IV. Maybe 20 minutes after I was brought back from triage, the doctor came by and introduced themselves. I gave him the quick lowdown as to what was going on this morning, and I gave him a pretty complete picture. I also let him know that I had some medical experience. I was in the medical field, and I think that also helped speed the process up a little bit as well. There were no real events or incidences that I could see that would have led to this. There was no, I hadn't had any caffeine that day. I hadn't, you know, had any strenuous exercise the day before. I wasn't stressed from school. I haven't been working. I took a week off from work just to kind of like chill out and study for an exam. And no drugs, no alcohol, no partying, nothing like that. There was really no impetus for this event that I could think of, and I communicated that to him as well. And he recognized all of that and kind of gave me a plan as to how we would treat this, and we went along with that plan. And so he came back maybe 2 hours later. My heart rate was still irregularly irregular, but they gave me some medications to bring it down a bit. At this point, it was like in the 130s, which was still about twice as fast as a normal person's resting heart rate. And I was just laying in bed. So we got some more medications on board. A few hours later, it was 110, which is their threshold for discharge, but it was still irregular. And so the plan was to be discharged and follow up with the cardiologist. And that was kind of that. So I was discharged, my heart rate was still irregular. And then, follow up with the cardiologist and figure out from there. You are treated, you have been saved. And so we had to set up an appointment for a cardiologist, and luckily there was a cancellation, but that was 10 days out. They recommended within a week. The next earliest appointment was in January for something they recommended a week out for.
And so you mentioned that you had a medical experience. Would you mind just briefly elaborating on that?
I am an emergency medical technician. I work for the county ambulance 911 provider. So I have taken patients to the hospital for things like this. So I'm fairly well versed in exactly what was going on.
Gotcha. So you knew what to expect going into the ER visit.
Yeah.
Um, And you had mentioned that you recently received a medical bill, and that might have been a bit. Well, I guess I'll ask you: was it surprising when you saw the bill?
So not only am I an EMT, but I studied public health in undergrad, so I'm pretty well versed as well in insurances and how they operate and deductibles and premiums and co-insurance and all that jazz. But it was definitely still a shock because there's a good chance you might die from this event, and the cost of not dying is in the $14,000 range, pretty much.
Do you feel that your medical coverage as an EMT was sufficient?
Absolutely not. I don't think any medical coverage is really sufficient in the United States the way it's currently set up.
Would you mind kind of sharing your opinions on the flaws of the medical system?
Sure. So back before the 80s, before George Bush Jr. took office, most insurance plans, over 90% of insurance plans, were called indemnity plans. I pay you $50, you cover my healthcare bills. That's it. There's no, 15-page medical explanation of benefits with 15 different insurance plans that you can have. It was a simple, I pay you for this, you take care of me later. And so George Bush Jr. passed legislation that allowed insurance companies to go for profit rather than not for profit. And within a year, I think it was now 90% were for profit. And that brought in all of these high deductible plans, all of these premiums, all of these co-insurances, all of these maximum out of pocket expenses.
George W. Bush's presidency did oversee several healthcare related policies, but I think it's important to note that for profit nature of the American healthcare system predates his presidency by many decades. However, during his tenure, there were policy initiatives that some argue contributed to the furtherance of a for profit healthcare system in the United States. One of which was the Medicare Modernization Act of 2003, where Bush signed the legislation into law which established Medicare Part D. And this prescription drug benefit was delivered through private insurance companies. And critics argue that this may have moved forward the role of private insurance companies in the Medicare program and contributed to the commercialization of Medicare. Moreover, Bush supported and expanded health savings accounts, allowing individuals with high deductible health plans to set aside pre-tax dollars for medical expenses. And proponents saw this as a way to give consumers more control over their healthcare spending. However, opponents argued that it favored healthier and wealthier individuals and could contribute to rising costs for those with chronic conditions. Do you feel like after you received your bill and it was, quite a surprise, do you feel that um, that might, I guess, deter you from future medical visits?
100%. If this were to come back, I have, a medication right now that can slow my heart rate now that I have not been taking in case this comes back. They said to take it. I kind of know the medicine and how it works. And right now, in my current state, sure, I suppose it could be beneficial, but I'm really holding on to that in case it were to come back. So I could avoid going to the ER and hope that it converts back to a regular rhythm on its own, like it did. I have the privilege of being able to make these decisions based off of my medical knowledge. The large majority of patients don't have that. So they have no choice but to face risk of death or serious injury or pay exorbitant medical bills in the thousands and thousands of dollars, which they more than likely, I don't think anyone can be hit with a $5,000 to $10,000 bill and just be able to afford it at the drop of a hat. So I think it's more of a privilege than irony in that sense that I can actually afford, in a sense, to make that decision.
In fact, according to the Kaiser Family Foundation, 4 in 10 adults currently have debt due to medical or dental bills. Additionally, there's also a disparity between blacks and Latinos compared to whites in terms of having significantly more medical or dental debt.
There's only two groups of people in the United States that are afforded universal health care, and it is prisoners and the United States Congress. So until they, Congress, not the prisoners, start to feel the effects themselves, they're not going to listen to their constituency. That's they vote to stay in their seats, in their power. They're not really. I mean, I don't think this is a unipartisan opinion here. I think the large majority of everyone that would be watching this would agree that the government does not have their best interest in mind, and this would be in their best interest. It would cost money. Where that money would come from is not a bipartisan issue, but we could definitely afford it if we wanted to. Other countries have done it.
Do you have any personal experiences of patients kind of refusing medical care because of the concerns of the medical costs?
Absolutely. I mean, it's something that we don't come across daily, but I definitely say it's a frequent occurrence. I'll have people with maybe vague symptoms, could be, maybe a small heart attack, could be a small stroke, could be just, illness, just unfeeling well, who are hesitant to go because there are no pertinent findings at this time. That's not to say that 10 minutes from now they won't have it. That's not to say tonight when they're asleep they'll have it and they could die. So, of course, we always, out of an abundance of caution, advise people that it's in their best interest to come with us in case anything changes or in case things get worse. We also let them know that they can always call us back if they change their mind or if they start to experience new symptoms, different symptoms, worsening symptoms. And so we do our best to try to convince them, but we also have to understand that there is a huge financial burden and that a lot of people are aware of that. So it does happen fairly regularly.
Would you say that the quality of the healthcare system in the US is significantly better than other countries, despite the fact that other countries have universal healthcare and arguably, significantly less
That's a
cost?
very opinionated question. I
Sure.
think the US, in terms of quality of healthcare, has akin to other, first world countries level of healthcare. I mean, we have top cardiologists in the United States. We have top anesthesiologists. We have top, neurosurgeons, but so do other countries. And the real difference in our top cardiologists and Canada's top cardiologists, the UK's top cardiologists, is access to healthcare. That doesn't mean, hey, I can book an appointment with this guy or this gal. It is, hey, they're booked up for the next 6 months. If you're having an acute medical, let's not call it an emergency, but let's call it a medical issue, 6 months is a long time. If you're concerned about cancer and you're waiting 6 months, that can metastasize, that can go from stage 1 to stage 3, that can be a death sentence. So our access to healthcare is significantly lower than other equatable countries. And our healthcare expenses are way higher than other expenses. And that's in a large part due to insurance companies and price gouging and stuff like that. All of these rates that you hear that the insurance companies have negotiated with hospitals, it's expensive to run a hospital. It's expensive to run an emergency room. Having staff 24/7, 365 to take care of a wide milieu of medical emergencies is very expensive. That's totally understandable. But in order for the hospital to recoup those costs, they have to inflate them so that when they negotiate with the insurance companies, they can come down to a reasonable amount. If they said, hey, the true cost of this was about $2,000, the insurance companies are going to negotiate for $1,000, and that's not going to pay for the lights. So they have to bump the prices up to negotiate the prices down, which then gets passed on to you, the consumer.
Here we can actually see a breakdown of the average waiting times for a specialist through various countries. And although the United States is less than some of the major countries on this list, it's questionable as to whether or not it is justifying the significantly higher costs out of pocket. And do you feel that the pros of having better access to healthcare outweighs the burden of cost on a patient?
If we were to have better access to healthcare, if I could see a cardiologist same day, next day, I would understand. We don't have that level of access, nor do we have that level of cost. So, to answer your question, I don't think so.
So you would prefer to see universal healthcare, but obviously the logistics surrounding that are quite complex. So if in an ideal world you could design, I guess, a healthcare plan for the United States, like how would that look to you as a healthcare professional?
Sure. So, people always want a choice. You can't force them into accepting a public option without also affording them a private option. If you want to pay for better healthcare, for higher quality healthcare, for greater access to healthcare, sure, fine, go ahead. That's your right. But there also needs to be a public option that catches people. In public health, we commonly refer to the donut hole, the people that are above the federal poverty line requirements to qualify for Medi-Cal, Medicare, stuff like that. That, I think the FPL these days is something like $22,000 for a single person and 30 something for a family. Don't quote me on those numbers, but it's roughly around there. $30,000 is not a lot of dollars. Now, the person that makes $30,001 no longer qualifies for thousands of dollars of, subsidized medical care. Are they any better off than the person making $30,000? Now, if we were to, compare them to someone that makes $100,000, the burden of these costs is lower. But there's this donut hole of people that technically don't qualify under these federal poverty guidelines, but aren't actually, well off. That it's a huge financial burden still for them, even though they technically can afford it according to the government.
Given that you've had experience in the field and probably also dealt with patient stories regarding insurance issues, what advice do you have to patients in regards to battling or conversing with their insurance companies to lower the costs?
Sure. So I think the most important thing is to be informed in anything, really. So, in terms of dealing with insurance specifically, first make sure that when you are signing up for insurance, make sure that you're signing up for a plan that'll work for you. Learn what the terms deductible, out of pocket maximums, in network, out of network, co-insurance, things like that refer to. Make sure you learn those before you need them, because when you're selecting your plan, you're going to have a little breakdown of everything that the plan covers. And it will give you your co-insurance is 40%. Your co-insurance is zero. There are pros and cons to all of these. If you're a young person, like most of the people here in PHAB are, you might not want something with a high coinsurance if you're not expecting a lot of medical costs. You might want something that's lower coinsurance and higher deductible. If you don't plan on using it, those are generally sometimes cheaper. If you have medications, if you currently have health issues, consider getting a lower deductible plan that might as well include some higher co-insurance, but that also will impact your out-of-pocket maximum. So make sure that you're familiar with all of those terms. And if it's not open enrollment, if it's not, time to select new insurance, go ahead onto your insurance provider's website and click on their medical explanation of benefits for your specific. That will list all of those things that I just mentioned. Sometimes they're nice and they give you a little breakdown like Margaret had a baby. Here's what her plan covers. Here's what it doesn't cover. This is her expected cost for having a baby. Or, John went and fell off the monkey bars and broke his arm. He went to the ER, and this is what it looks like. They usually give you the breakdown for emergency room visits, urgent care visits, primary care specialists, and stuff like that. So make sure that you take a look at that. Also, make sure that you take a look and see if you qualify for Medicare and or Medi-Cal. Usually those limits are pretty low, but if you are an independent, your parents can't claim you on your tax return, or if you're married, those numbers change and they can be sometimes pretty dramatic. If you have a spouse that's in school and doesn't work right now, you're the sole provider, you might qualify. So take a look at what you're making and what your household is making and see if you qualify for the public option that currently exists. Additionally, there is Covered California. I think most people have seen the ads probably or have at least heard of it at some point. Know that Covered California isn't an insurance policy. It is a publicly run marketplace for you to find health insurance if you're not doing it through your employer. That's also an option for you as well. If you end up in the ER because you had an irregular heartbeat, beating really, really fast, you do have a few options. If you don't make a lot of money, a lot of us are students, we don't make that much. There are usually some sort of financial assistance programs that the hospitals do offer. You're going to have to reach out and look for those yourself. They're not going to just offer them to you. Another thing you can do as well is ask for an itemized list. That usually drops the cost down substantially because not a lot of people do that. You're entitled by law to a itemized list of the care that you received. Go over the billing codes. Usually all of the bills will have the billing codes. Make sure that they didn't make a mistake. Medical billing is done by people that are remote, people that are working two jobs. Errors happen. And sometimes those errors in the code can be the difference between, what's covered and what will cost you thousands and thousands of dollars. So look into that as well. I think that's all I've got.
Well, I can't say how much I appreciate your time and also sharing your depth of knowledge on this subject. And I look forward to seeing you advance in the field of medicine. And if there's any last final thoughts, I'd love to hear them. If not, I genuinely appreciate your time.
Healthcare is a human right. You should be supporting a healthcare for all option. That doesn't mean that they'll take away your private insurance that you like so much. It just gives people that don't have any other options a way to get healthcare, and that should be a human right.